Hi, welcome to Working Smarter.
Working smarter.
Working smarter.
Working smarter.
I've been all around Village MD.
From the fine city of Houston to New Hampshire and everywhere in between.
I've seen the great work
our people are
doing.
It's such an incredible, exciting,
Fantastic
time to be at Village MD.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD. And today we have a special episode that we're thrilled to bring you where we're talking to folks from our providers' offices all over the country and finding out how things are going and how they're doing in light of the COVID-19 crisis. So I'm pleased to introduce and welcome Lashana Tizenor. She's a certified medical assistant from our Houston office. Tell us a little bit about your position at Village and how long have you been working with the practice in Houston?
So I am, the title that I hold is a part of the clinical support staff. So I work alongside the other MAs. And so, we're prepping patients every day for, telemedicine appointments and triaging if they do come in office and nurse visits, all the fun stuff. And I've been here. So this month will make my second month, around the 20th, the 23rd, around that time. Yeah.
Wow. Well, welcome.
Thank you.
We're glad you're here. How are you working and what kinds of appointments and what kinds of services are you offering to patients now, given where we are?
So currently right now, I work I'm still in like that training period. So I work alongside one of my other coworkers and she's been an awesome a preceptor. It's just been wonderful. Just a good wealth of knowledge. And pretty much what we do on a day-to-day, we come in, we prep appointments, for patients who have telemedicine, the virtual appointments. Even if it's a phone call, we make sure we're answering, doing patient cases, making sure that patients are getting their medications refilled. If they need pre-op appointments, how are we handling pre-op appointments? Nurse visit rotations, still doing shots. I mean, we're still active. We're still acting as a functioning clinic, of course, but we just don't have as much patient flow, which is kind of weird. But It's been going great. Yeah, it's been going great, and we do stay busy. I mean, it doesn't matter, patients coming in and out of the office. We still manage to stay busy, which is awesome.
Yeah, that is good.
Mm-hmm.
That is good. What's been hard about your work with the pandemic?
Hearing patients who are at certain levels in their lives where they're alone, hearing that onset of depression, and you can hear it in their voice, and what they're doing, and but when you get on the phone with them, that light in that moment, when you can give them light or hope in some way that everything is going to be okay, it's just the most beautiful thing ever.
So you're hearing the isolation and the loneliness in some of our patients, especially those that live alone or some of the older patients. Is that making it hard on you?
No, I think this is probably one of the biggest challenges because I'm a busy bee, right? We come into healthcare to work fast and move. But this has been one of the most, it's allowed me to work on my communication skills, right? So you're transparent, you become a little bit more transparent, you become a little bit more empathetic and sympathetic, especially when you can relate in some situation, with me.
Yeah.
And that is one thing I do love about this moment in time, because we have the opportunity to really connect with our patients. It's not just picking up the phone and saying your lab results are this, get off the phone. We have that little moment, maybe the extra 5 minutes to say, hey, how is your family doing? How are you overall?
Yeah. So how are you taking care of yourself?
Staying quarantined, pretty much. I roller skate, I cook, and I have a garden. So I have my own personal hobbies.
Awesome.
Yeah.
What's in the garden?
Really busy, huh?
What's in the garden?
Okay, so I just gave away some basil to one of my coworkers. I got some lavender. I got a pineapple growing. I have some palm trees.
We're gonna need to see pictures.
Oh, girl, yes, I have. Trust me, I have it.
Do you have any message that you want to give your coworkers or our listeners? Is there anything important that you want to tell us?
Be blessed, because we do get to come into work, and depression is real, at this time. And the patients look forward to us calling them. Sometimes you have the ones that fall through the cracks, but then there's a big percentage of patients that do love hearing from us and knowing that people are paying attention to them, especially your healthcare providers, So it's nice. It's sometimes that follow-up call that just brings a smile to their face that you don't even know what's going on in their lives. So if you can do that, you could be that transparent and leave everything else at home at the door. Your job is fun. It's easy.
Next, we're going to be joined by Jan Myers. She works in our Arizona clinic as a clinical educator. Jan, thanks so much for joining us.
Sure.
So let's start off by, what do you do at Village MD and how long have you been working here?
I'm a clinical educator. That's my formal title here in Arizona. And I've been with Village since February of this year. My job is just, as my title indicates, I'm here to help educate staff, make sure that we're adhering to the best practices.
So Jan, what are you doing as a clinical educator during this time? Like how are you helping our frontline staff and our physicians?
What I do is I go out in the clinics and help to educate the staff on procedures that we're implementing, such as the nasopharyngeal swabs. I'll help them make sure that the staff that has to complete those as educated know how to complete that.
So what has your experience been so far since the start of this pandemic?
Oh, it's been challenging for sure, especially at the beginning. Because of the fluid nature of the pandemic, we didn't always know what to expect. And the recommendations from CDC and other health experts were coming at such a fast pace that it was challenging to keep on top of their recommendations. That being said, I've also experienced and witnessed some really inspiring and uplifting moments too, like watching team members step up in unexpected ways to help each other.
So what is the biggest challenge that you faced in light of this pandemic, and how are you working to overcome that?
I would say the biggest challenge has been having to reimagine how we interact and care for our patients on a daily basis to ensure their safety, as well as our staff. I think staying up to date on the most current information, a lot of team collaboration, reaching out to other markets within the Village family to see how they're doing things, and remaining flexible and open to new ideas are the best way I found to overcome the challenge.
What are your recommendations on how people can help at home?
First and foremost, don't get complacent. Listen for CDC and local health expert recommendations. For now, continue to wash your hands frequently, wear a mask or face covering, maintain social distancing when out in public, and take care of yourself. Get plenty of rest, eat right, exercise.
Yeah, those are all really great recommendations. We've seen a lot of tragedy in this pandemic, but we want to spread a message of hope. So can you tell us what gives you hope in this time?
Sure. I think what gives me the most hope is seeing and hearing about the selfless and positive ways people have come together, donating time, their food, money, and sometimes even risking their lives to help others. I also feel hope in the way gratitude has been expressed to essential care workers. And I'm really optimistic that in the very near future, we will identify effective treatments and a vaccine to treat and prevent COVID.
Yeah, I think we're all hoping for that as well. What are you doing to take care of yourself during this time?
Well, I think it's important to set limits and remember to take time for yourself. For me, that means taking time to get outdoors. I enjoy gardening and swimming,
So next I want to introduce, and it's my pleasure to have a chance to meet and introduce Tamira McKenzie. Tamira is a family nurse practitioner in our Texas market, and she is unique because she works both in the clinic and also with our at-home division. Now tell me, how long have you been working with Village MD?
I've been working with Village since June of last year. Our clinic in League City was acquired by the Village Medical family, and so we've all been a part of Village Medical since then.
Tell us, what has been your experience during this pandemic so far? What's it been like, and how are things going?
Well, my experience has been, in my opinion, pretty favorable. Right away, Village did a wonderful job with rolling out the education and everything for us to go ahead and start the virtual visit. So I think in probably 2 days' time, they had the Houston market up and running, and we were doing virtual visits. And since that time, which would have been probably late March, early April, For me personally, I haven't had an issue. It's actually been a service that I'm glad that we have, because we've been able to still admit patients to the Village at Home service, even though I haven't been able to like physically see them, that to let them know that I'm still here, I'm available, help is, always there for you guys.
How are your patients doing? Are they holding up? Are you seeing people in distress?
For the most part, the patients that I have encountered are holding up pretty well. I do have some that suffer from depression prior to COVID. So those that I know have kind of been suffering throughout this time, I've been able to reach out and contact them. Sometimes I'll just do a generic telephone call just to say, hey, I'm in between patients, but I just wanted to check in on you and see how everything was going. So for me, the main thing is basically keeping those lines of communication open with that depressed and or anxious patient to let them know that, hey, we're here and we're being supportive, even though we're trying to keep everybody still safe.
Got it. That sounds fantastic. What would you say is one of the biggest challenges that you've had to face and try to overcome working in this environment?
The biggest challenge is the adaptation to technology. I had never done like a Zoom meeting or, had to do consistent phone conferences before COVID. So it's just been, and I'm not a real tech savvy type person. So that's the main frustration that I've had. Like, you have an elderly patient, you're trying to, walk through how to connect virtually. And sometimes that gets a little frustrating because they don't really know what they're doing and we don't really know, on this end. So that's been a process that as we've gone on, it's gotten better. But I would say that was my biggest frustration, is just adjusting to the technology of having to do the virtual visit since the start of COVID.
What are some things throughout this that give you hope for the future, or that we're going to overcome, or that things are going to be okay?
What I try to do, even when I talk to my patients to instill that hope, is just to let them know that, hey, everybody is working on this. Like, the whole world is concerned about this particular virus. So that's the good thing. That's working in our advantage, because we're going to see things turn around more quickly than we did with like HIV, or than we see with a TB or something like that. Diseases that had to be studied for 15 and 20 years before we made actual progress with them. I don't feel that towards COVID. I feel like everybody's hands are in the pot. I think we'll be making those new discoveries and coming up with better ways to do the contact tracing and the testing and vaccinations and things like that. So that's what gives me hope. Things can always get better tomorrow, even though they're not so good today.
Got it. Well, thank you. That actually kind of cheered me up, I have to say. I might just call you back again. How are you taking care of yourself, Tamira, during this time?
When I try to get everything done during my working hours, so that when it's, that 5 o'clock hours come, I can be at home with my family. And even the times when, because my time is split, some days I'm at home because I'm doing the Village at Home, and then other days I'm in the clinic because we never close in the clinic. Holding myself accountable, making sure that I'm getting those charts closed off and getting things done in a timely fashion so that I can have that true downtime. For me, that's, my family and my spirituality I've leaned very heavily on throughout this time to make sure that I'm just properly decompressing.
That's great. Well, I just want to express on behalf of Village our gratitude for you and the work you're doing for our patients. We're so thankful for the care that you've expressed today. And we hope you'll come back sometime and check in with us again.
Thank you to our sponsor, Village MD. We hope you will join us for future concise compliance conversations.